Good morning, and welcome to the October 19th meeting of the Sedgwick County Stimulus Review Team for the CARES Act. Today we're going to be going over, continue reviewing applications for the public health and social service funding. Before I get started, let's go ahead and take roll. Dr. Walker?
Present.
Hope?
Here.
Jane?
Here.
Kyle?
Here.
Mark? Not hearing him. Melody?
Here.
And Brent. Okay. And as you might have just seen, Brent will not be with us today, so you get to put up with Hope and I for this entire meeting. So let's go. Yeah, right? Before we get to some new business, I'd like to go ahead and adopt minutes from the previous meetings. And give me one moment here.
I admit I haven't had time to read them. I got them at 9:30 last night, so I haven't read them.
Well, if the team prefers, we can wait until our next meeting to catch up on those. Myself and one of our interns has been going over all these notes and meeting minutes. It's a bit of a job with all the back-to-back meetings we've had. So again, if it's the will of the team, we can wait until the next one and the next meeting until people have time to review them more.
Does
That
it
sounds
need
good,
to
Aaron.
Yeah.
I don't think we need a motion for that.
Okay.
So,
Yeah, there's no, you can just move it.
nope. All right.
If anybody else read them, that's fine with me. I just haven't, so I can't vote on something I haven't even read.
Understandable. All right, well then, with that, we'll go ahead and get into some new business. I'm going to go ahead and show you exactly how much we've allocated for funding after last week's BOCC meeting. And the total comes to $11,716,017, and we have just over $6 million left to allocate. Okay. Can everybody see that?
Hey, Aaron,
Yes.
has the county commissioners actually awarded any of these amounts yet, or is it just, we've just recommended award?
No, they have voted on it, and agreements have been
Okay.
sent out to several of these organizations, and we're starting to get many of them back. So,
Okay.
yep, so funding is starting to move. We also decided that the PHSS application is going to remain open until October 31st, so that organizations have an opportunity to fill out and submit an application if they haven't already. We at the county are working with the communications department to raise some awareness, and we have Assistant County Manager Tanya Cole and Akeem Ashford, the Director of Communications, on if you have any questions for them specifically. But last week we did have a meeting, and we went over some strategies, including some new graphics that will be developed specifically for the Hispanic community. They'll be translated. Also, and Akeem would probably be the one to speak to this, but I guess there has been some hesitance from the Latinx and Hispanic community to move forward on applying for some of this funding. Is that something you can speak to a little bit, Akeem? Or Tanya, if you're available.
Sure. We had a conversation with Claudia Morrow, and Aaron, you might just have to catch me up because I caught just a little bit, just a brief minute of what you said there. But, we had a conversation about the Hispanic community applying for some of these, for some of this funding. And I think there was a question of some of the application questions and qualifications. And she was going to follow up with some of immigration attorneys, I think, in Kansas City, just for follow-up and get back to us. And I haven't seen those follow-up questions as far as, process and eligibility, as far as, again, just being able to apply for those applications. And like I said, I haven't seen those follow-up questions, but she was going to get back with us. And I think those were, just some basic concerns from the Hispanic community on being able to qualify for some of the funding.
So what does that mean in terms of timeline? I know time is of the essence. We're down to the number of days in order to reconcile and hit that November 30th date so that we can know what's been encumbered. And then, of course, the December 30th date for actually expenditures. Did Claudia give us a time that she would be able to get back with us? With
Yeah,
some detail?
she thought she was going to be able to turn that around fairly quickly. I mean, we had a conversation with her on Friday, and I thought we were going to hear back from her that same day, if not kind of over the weekend. But she may have had some trouble getting a hold of, some of the folks that she wanted to get in contact with. But it was my understanding that she was going to try and get some information back to us ASAP.
Right.
So that we would be able to, kind of maneuver and just help her with some understanding of, how the funding and the applications work as far as, questions, and just try to help her on her end to get the information out, to kind of spread that information out in her community so that we could see some more applications within the Hispanic community.
Good morning, Tanya. This is Melissa.
Morning, Dr. Walker.
So this is just an observation, I guess. If you're not accustomed to applying for government funding, you might look at the application form and go, oh my goodness, what do I do with this, right? So in the communications, I think it would be helpful to emphasize the things that you can apply to do. So PPE costs all the way back to March, disinfectant costs all the way back to March, anything that agencies that have done to support delivery of services remotely, so helping staff do that all the way back to March. I think it would be important to emphasize those things, that the resources go to the organization, and then the organization provides the services. So if there are concerns about the citizenship status of individuals receiving services, that shouldn't be a concern. And hospitals, clinics, many service providers provide services to people regardless of citizenship status. I think it's important to emphasize these things in the application.
Thanks, Dr. Walker. We'll be sure to pass that information on. I think it would be good if we could, and I don't know if this is appropriate, but perhaps somebody from finance can help have that discussion with Claudia, just to help, understand, because, we're in the communications, and I think if we could have somebody, perhaps Erin or Hope, like I said, if that's appropriate, just to have those conversations, to have that understanding with Claudia on that part, I think that would be very helpful.
That sounds good, thanks.
And that's probably something that we can get sorted out, Tanya.
Okay, thank you.
Yep. Building on that, some of the strategies that Communications has identified and some of the partners that they've identified are the Nonprofit Chamber of Services, Active Aging, the Asian Advisory Council, and mental health organizations like ComCare and CCDO that they'll be reaching out to make aware of the application and where and how it can be applied. On from that, I believe we have been discussing with BKD kind of what you guys were talking about before the meeting started, reallocating some of the funds that organizations have been given. And I think, Hope, you have some, do you have the information on that?
Yeah. Our guidance from BKD is that since the contracts don't specifically speak to the specific expenses that are allowable for the applicants, it's okay to allow the applicants to reallocate the spending. So basically, if we see a need where an agency's circumstances have changed and it's not a material dollar amount change, then either way, if it's material or not, we can bring it back to the group for approval. We haven't actually seen any material asks right now for reallocation. I think maybe just because the contracts are actually starting to go out now, so applicants might be looking at that and thinking. But again, if we get a material change from the applicant wanting to reallocate, we'll bring it back to the group for approval.
Any questions on that?
No, that sounds good. Thanks, Hope.
All right. And just as a reminder, these meetings will continue as applications come in. We have started working and looking at, or looking for new ones that have come in, but we don't have any new ones today. This group will also be looking at the municipalities and the purchases they've made for reimbursement. So with that in mind, we can go ahead and jump into the actual reviews for today. And I believe—
Hey, Aaron, before you jump in, can you clarify that?
Me too.
So municipalities, meaning municipalities wanting to deliver health and human services?
No, this is for the funding that we gave municipalities. They have been making purchases and they will be submitting once we get the website to a place where they can, receipts, purchase orders, things like that, and you'll be looking at some of those.
Looking at them how?
Reviewing them to make sure that they are within CARES criteria and meet the spending requirements.
So this is a new request of this committee. We haven't reviewed any of the requests from the municipalities. We're not familiar with these requests. Why the change?
Aaron, is this just if there's questionable expenses that maybe they need to look at the receipts? Is that kind of what we're talking about on these?
Correct.
It won't be every single receipt. It would just be if maybe there's a question, if it's a little bit out of the range of what they had put in the application, but wasn't actually, I don't know, we're just trying to make sure that the expenses they are actually within that range of what was in the application. Lindsay, were you going to say something?
Yes, ma'am, if you don't mind.
Yeah.
So, hi, everybody. This is Lindsay. Just to clarify, so the Financial Stimulus Review Team was initiated at the beginning to kind of focus on the out-of-county spending, so not the internal spending, but the external spending. And so there were separate buckets that were set up for cities, for schools, for public health and social service. And then we also had some money that came from the State Spark Committee, and that's a business focus. So what we had done was with the schools, we advance funded them 100% of their dollars because of the circumstances that was done back in late August, early September. And so we won't need to review their expenses because of new guidance that came out from the federal government on September 2nd that said up to $500 per student, the expenses are considered to be basically legitimate. So all we need to do is make sure that they tell us how they're spending their funds so that we can report them accurately in our federal reporting. Now on the city side, we actually have gone through 2 rounds of allocations for cities. So originally, the Commission authorized $10.1 million for cities headquartered within Sedgwick County. We advance funded 50% of those dollars, about the same time frame as schools. Since then, September 23rd, the Commission actually increased that allocation for cities from $10.1 million to $15 million. And that is on a per capita basis. So we have some numbers that we've used to assign those dollars. And now what's happening is those cities have started, though our reporting portal is not yet up and functioning to most folks' consternation, rightly so. We will start to receive those documents, and we will make sure there will be kind of an internal review that's done to make sure that those expenses are compliant. And then we'll come to you basically with a recommendation that you approve or don't approve. Now, cities can only get access to their second round of funding, that amount over and above the 50% that they got initially, plus their new money, if this committee says that those expenses are eligible. Now, on this, it's going to be a lot more straightforward because we're going to have so many pairs of eyes on it. It's going to go through our auditors, it's going to go through BKD, and then it's going to come to you. So we are not asking for nearly the same degree of analysis and discussion, hopefully, from you all. Hopefully it'll just be more of a looking at it and saying, yes, this makes sense. Here are the questions, and making sure that what we're doing is fair and consistent, if that makes sense. So that is kind of the approach we're taking. Because they haven't even been able to turn in any reports yet, you haven't been able to see anything yet. And so we were simply trying to get that public health and social service dollars out the door as a very high priority for the community. So hopefully that kind of makes sense on why we're going the route we went, and I apologize for that confusion.
Question. I got over the weekend, I think from Hope, Whit O'Brien's comments on the Crime Commission. We've really got nothing from Whit O'Brien on. Some of these were not things I had thought about in looking at requests. Are they going to give us something then? I mean, this was more extensive things we should be looking at than I think we necessarily have been. But we have no guidance.
Well, and I think so the way we are using Whit O'Brien's is simply we ask them questions when we don't know the answer. And that is why Kevin Stamper, who is an assistant county counselor, and I kind of staff this because unfortunately we live and breathe CARES guidance. And so that's why if we have questions, we're trying to get those resolved on specific things. So far, we really haven't seen much that's not eligible based on the circumstances. But if there is, and you'll notice, generally I'm the one that pops up and says something about, please take this into account. Or if you have questions, we're routing those to Whit O'Brien's if we don't feel like we can answer them. But they're just a consultant. They're not necessarily reviewing everything, and we haven't asked them to do that. We're asking them to kind of step in on those areas where we're not sure, if that helps. Now, if you would like something from them, some general guidance or anything, I am more than happy to ask them to provide some details.
Well, I guess I would like some. I don't want a book, but I don't know. How would the rest of the committee feel? A few of these comments on the Crime Commission were, maybe I haven't been looking at these thoroughly enough because I didn't have any guidance.
I feel that we've done a good job of engaging in due diligence and carefully reviewing the applications. And during the discussion of these applications from the Crime Commission, the points that Whit O'Brien raised were raised by someone, maybe not quite the way they framed it. I'm glad that Lindsay said that we can consult them, because as we continue to allocate resources, and if we return to some of the applications that we have and think about allocating additional funding, then we might want to talk with them about that. And that was one of the questions actually I have, maybe for Whit O'Brien, or maybe this is for you, Lindsay. What happens if we see something in the applicant pool that we want to fund that was proposed that we didn't fund, or we did fund it and we want to allocate additional money beyond what was requested? Is that permissible?
So that's actually probably more a question for the audit firm, to be honest with you. They're kind of the grant compliance and monitoring. And so if we want to award more, we probably just need to allow other folks to make the same type of request so that we are being fair and equitable in our approach as the grantor. That's why we've been somewhat careful about going out and directly engaging potential subrecipients, because what while we have some information about vulnerable populations that justifies us doing some of that, we have to be cautious about how specific we get with some of that to protect the county as the grantor from appearing to solicit certain things. So if there's a particular group that you think would need some specific funding, certainly we can go back to them and say, is there other funding that you have? And we can ask that question. And then if maybe we can identify a similar bucket, a similar type of service, potentially we could go back to those same entities that made the application and give them the same type of opportunity.
That makes
Yeah,
sense. That sounds like the fair way to do it.
I agree, and that's a slightly different question than the one that you asked me earlier, which was about whether we could go back and reconsider a portion of a request that we didn't grant the first time. I think you could, on a vote of the committee, go back and look at a request that was already pending and decide whether you wanted to award up to the full amount of the request. But that's a little different than going and deciding that we want to offer new money to them they didn't request.
I have some,
Yes, it's a different question. As we meet, I think of more questions. That's kind of what I do.
I have some I have questions also. I want to go backwards to the original conversation in regards to the scope of work for this committee and being able to build in us reviewing the municipality proposals. So that is the question. I believe that it was in our original scope of work. Is that what you were explaining, Lindsay?
That it is or it was not? Because I had thought it was.
That it is, yes.
Okay.
Yeah, no, that was my understanding, that it was a part of it. We focused on the public health and nonprofit. And first, we did that first. So I'm, okay. And along the lines of ensuring that we have guidance, what I'm not clear on is, even though they've been vetted, the proposals have been vetted, it sounds as though 3 times, before it comes to us as a committee, I'd like to see what we're supposed to be looking for. Is that something that you can share with the committee?
Absolutely, yes. And in fact, I'll send you, as I've based on Jane's question earlier, I kind of been mulling that point. So what I think we could do, if it sounds okay, is basically go through some of the agreements that the commissioners have approved with these folks. Now, some of them are between 16 or 23 pages, so I'm not going to give you the 16 or 23 pages. But what I think what we can do is distill down what the eligible expenses were that were included there, what was not eligible, kind of give the general scope. And then also, Witt O'Brien's has provided a personnel brief that relates to government, so it hasn't been as applicable to some of the discussions you've had so far. But they have provided that memo, which has been immensely helpful to us. We have provided it to cities, and so I don't see any reason why we can't provide that, plus kind of the general eligible and ineligible expenses to this review team. Maybe we can even post it out online so that folks can see what you're doing, what you're considering, just to make sure that we're being as fully transparent as maybe we move to that next part of the process. Does that sound okay to the committee?
That'd be helpful.
Yeah, that would be perfect.
Okay, my pleasure. I'll get that to you before the end of today.
All right, thank you.
All right, if there's no further questions on that matter, we can go ahead and start reviewing applications. So, Hope?
Well, hang on. Sorry. So since Tanya and Akeem are here, we've voiced this before, but it came up earlier in our conversation already in this meeting. Clearly, there is a gap in proposals from agencies that serve the Latinx community. And one of the areas that I am concerned about is communication to that community in particular. monolingual Hispanic, that community. So with respect to the new wave of applications, I think it would be important to try and identify and encourage agencies or firms that work in that community and do communications to propose something in that area specifically.
Akeem, are you on?
Yes, ma'am. I'm here.
Okay. Akeem, do you want to talk about your meeting that you had with finance and how you're going to strategize on the new kind of round of communications for kind of the new deadlines? You had a proposal that you worked through with finance, and then you might just talk about, or I can talk about our meeting that we had with Claudia and Christina just this last Friday, and talking about how we can try to get the message out to the Hispanic community, or you might hit on that a little bit. But I'd like you to talk through, that one pager that you came up with and sent out.
Yes, ma'am. Absolutely. Good morning. Okay, so we had a meeting, and I say we, it was my team as well as the folks from finance. And we just kind of talked through the communication goals and objectives that we had. And so we noticed with the help of the finance team that we needed to develop a graphic. I'm not sure if the review team has seen some of the graphic work that we've worked on to initially communicate the business grant, but it's going to look much the same as the previous graphics that we sent to those businesses. But this updated graphic will have the $6 million total that's left in funding. Our arts director is actually working on that today. We hope to have that out this afternoon. And so what we did early on, we found what was very helpful to a lot of those businesses were small handheld postcards, as well as emails, flyers, that kind of thing. And so folks like Christina Long with CML Collective and Claudia with ABC Bilingual, what they're able to do is they're basically able to take those directly to those businesses. So it has all of that information that those organizations will need. So we'll do much of the same this time around. We noticed that a lot of that information has been translated, and Claudia has done a wonderful job working with my team on that. And she's going to do the same thing this time around to make sure that we're hitting those Hispanic communities. There was a question asked about when do we stop promoting to receive applications? And so Brent was brought up the point that, there's a process, right, that these applications have to go through. So it looks like the 31st of October of this month will be the last date that they'll accept applications. That way, the review team can approve them, and then they can use those funds before the end of the year. As Tanya kind of mentioned earlier, it was noted that the Hispanic community still has questions about the immigration status. That was one of the big things that Claudia said that she really needed to research. And at this point, I can tell you, I have not heard back, and it doesn't sound like Tanya has either, on folks who are just really scared about immigration status and applying for those dollars. She said that she would definitely reach out to those businesses and those organizations who will qualify for the Public Health and Social Services grant to kind of let them know. It was also noted that a lot of them are contractors, so they have contract workers, so subcontractors who work for them. So there's a little nuance there as well that kind of has to be worked through. So what we plan on doing is a lot of the same things that we found that worked: social media within the county, as well as those organizations like Claudia, radio that are specific to the Hispanic community. We also talked with Bonnie last week with COP Media, just to come up with some very quick strategies. And so basically we can geofence to those organizations. We can target them through TV, through social media, there's a number of ways that we can work with COP to actually hit those organizations within the Hispanic community to be able to encourage them to apply. We're also going to reach out to active aging, nursing homes, the Agent Advisory Council through emails, media releases that we'll send to those organizations as well as our media partners. And then the other part that was really noted was the mental health organizations and the partners with ComCare and the CCDL. So there are a number of things that we actually have available at our disposal to make sure that we reach those organizations. We also had that conversation with Claudia and Christina Long last Friday. And I thought it was a productive conversation, and that's kind of where a lot of these thought processes came out of as well, that we brought to the finance team, Tanya and myself. So we think that we can. There's just, I think, some questions that have to be answered before we can move forward. But I think we've got a pretty exhaustive list of ways that we can hit those organizations right now.
Appreciate that, Akeem. Thank you.
You're welcome.
Any further questions for Akeem or Tanya on outreach for the application? Seeing none. So now, if we're ready, we can start reviewing applications. So, Hope.
All right. So we will first talk about the African American Council of Elders of Wichita-Sedgwick County, and we'll look at the application 697. I know that the group had a few questions on our last meeting on the $174,000 for the workforce development and also the $30,000 for the food assistance. I did get a response from the applicant, and I had sent it out, I think, yesterday, as soon as I got it, last night. So item 1, which is the $174,000 for the workforce development, they have withdrawn that due to a compressed time frame. So we don't need to consider that $174,000 anymore. And item number 2, which is the $30,000 for food assistance, is a collaborative effort with Women to Women and various local farmers led by Pearson's Farms to provide fresh fruit and vegetables to residents in the community at no cost. And that was for, I'm sorry, that was not for the food assistance. That's what they said was for the expanding service ask. Sorry about that.
Well, how is that different than Common Ground that we've already funded? Because wasn't that the same farm group?
I am not sure on that. I just know that's a piece of what they're wanting to do is provide the fruit and vegetables.
Melody and Melissa knew more about Common Ground than I did, but wasn't that the same group?
Yeah, I'm looking, if, I don't have it in front of me, but if it says Common Ground, I don't have that one up.
It doesn't say Common Ground, it says Pearson.
Pearson Farms, yes, it's the same. Pearson Farms is Pearson Farms, but Donna McClish Pearson is the principal in Common Ground, which they're duly connected.
Okay.
So I think they're the same. I think they are. So I'm trying to understand. Okay, let me actually have it in front of me.
Because we funded Common Ground with $286,000. That was also fresh food. I thought. I mean, that's my recollection. I don't know what Women to Women is. You're muted, Melody.
Sorry about that, because I was looking for something, but yes, Women to Women it's a nonprofit that is run by, and I believe she's the director of, and it's Bernia Williams. She's done it for quite some time. I think Bernia Williams actually is in the hospital right now. You may, and this is for Hope, be getting some additional information from the elders organization on the food assistance portion of it, because yes, Common Ground, to my knowledge, is going to be the distribution network for getting fresh fruits and vegetables into the community, and they have already been funded. So I don't know if the elders knew that. So I believe you're going to probably get some more contact from the Council of Elders. And once again, that's for Hope or Lindsay.
That you're wanting me to reach out, or you think I'm going to get something?
Oh, it'd be even better if you would reach out so that you could ensure that the clarification is there, that if it is Common Ground, let them know that we have funded them already to do exactly that. So how does this dovetail in?
Okay, I can do that.
If it does. To me, would be the specific question that you would ask.
Okay.
Because I'm not sure that they know that. Wow. So on the other, just wanting to clarify that the 174, which was for workforce development, has been pulled.
Yes.
Okay.
So would the group like to wait until I get some more communication back on the $30,000 for the expanding service cost?
Yes, I would.
So I got lost in the conversation there. $30,000 for expanding services to do that's the food piece?
Yes. Sorry, I probably started that confusion in the beginning because I just kind of assumed it was food since they had that exact same amount for their food request. But we already approved the $30,000 for the food request last meeting. So the $30,000 we're talking about right now is for the expanding service cost, and that is for the fresh fruit and vegetables.
Melody, why do you want to wait?
I'd like to be clear on the 30,000 that is for distributing fresh fruit and vegetables into the community, where they thought it was going to be, I think, connected with Woman to Woman, but we're not sure. I'm not sure. So is it clear to you, Hope, in the correspondence that you received?
Is it clear? Sorry, what was that question?
Okay, so is it clear is it Woman to Woman that was going to be distributing the fresh fruit and vegetables, or was it Common Ground?
They didn't talk about Common Ground at all. This group just kind of brought up Common Ground, so they just talked about.
Okay, so that's us bringing Common Ground,
yes.
knowing that we've already funded them, knowing that that's what their role will be, is distributing fresh fruit and vegetables. So that's, hopefully that's clear. Okay, so then it was Woman to Woman. That was going to do the expanded services, which was distributing fruit and vegetables into the community.
Yes.
That's it solely. Woman to Woman, once again, I do know that Bernia Williams is in the hospital. So she's not necessarily a one-woman show, but it's not a deep staff. I don't know that there's staff. So I think that's probably changed. So yes, I'd like to know how it's going to be done, who's going to be coordinating it. Yeah.
Well, his reply said it was led by Pearson Farm. That's what got me to Common Ground.
And they are one, and to me, it would be easiest if we were clear on if Pearson Farm, is doing this solely on their own versus up under the larger entity of Common Ground, which is actually incorporated. And I know that Donna McClish Pearson is the lead on that. So I think it would be good for us to be very clear on who would be doing this, how it would be getting out there, and if indeed it is Common Ground and that they've been funded to do this, how they would incorporate more, if that's what it is, and if the committee would support that. Got it, Hope?
Got it.
Maybe.
I think so.
So yeah, Dr. Walker, that's why I would want to wait, and maybe there's just some other things I would like to be able to consider.
I think those are all good points, and I'm not clear about them either. So just get concerned about delaying.
I agree.
Yeah.
Yeah, I agree.
All right, do we need to do a motion on that, or is it just okay to hold off?
I think, yeah, we can just hold off on that.
Okay,
We can just table that for the next meeting.
sure. All right, so the next one that we have are the 2 Wichita Metro Crime Commission applications. So we'll start with the one ending in 684. And we did get some information, and I think Brent had sent that out to the group from our consultants, and we did kind of talk about it a little bit earlier. Let me pull up the actual application.
Whit O'Brien seemed to pretty well shut down all of those.
Yeah. Yeah, so the one that we're talking about first, which 684. Pulling it up in our Salesforce system here. All right, got it. So this request is for $40,000. And this is the request that is talking about okay, so this is for their advertising needs. So trying to see which one this is. Okay, so they said they needed additional information about the marketing campaign. So on this one, I didn't know, Tanya or Akeem, if you guys have any additional information you would like to talk about.
Sure, I'd be glad to. Hope you want me to just go ahead and jump in?
Yeah, sure, that'd be great.
Okay, so at the request of the review team, we reached out to the Wichita Crime Commission, Sharon Van Horn, and she put us in contact with Brenda Dietzman, who we had a conversation with last Thursday, and it was Brenda Dietzman, Misty Bruckner from Wichita State, and Jen Wilson, who serves on the Mental Health and Substance Abuse Coalition. And it was Akeem and I who had this conversation. They also followed up with a one-pager that I sent out, and I don't think we were able to get to you on time, but I will just try to summarize that one-pager as well as the conversation that we had with Brenda, Jen, and Misty. So again, what they're trying to do is put together a communication strategy and plan. What their goal is to get information out to the African American population, Hispanic, as well as the Asian community, and those low-income neighborhoods who they say have been hardest hit, impacted by Sedgwick County, in Sedgwick County by COVID, either by health implications or economic loss. And they have quoted a recent Kaiser Family Foundation brief that states many adults are reporting specific negative impacts on their mental health and well-being, such as difficulty sleeping or eating, increases in alcoholic consumption or substance abuse, or worsening chronic conditions due to worry and stress over the coronavirus. It says, to complicate the matter, data indicates stigma associated with mental health services is higher in the African American, Hispanic, and low-income populations. So their goal then with the project is to educate those populations of the mental health services that are provided in our community in Sedgwick County. And again, they want to break down the stigma attached with getting help, mental health services, and substance abuse services to not only survive, but to develop tools that help them through these unprecedented times. And so we talked to them. They plan to work with A.B.C. Bilingual Resources, as well as CML Collective, who we also work with in county communications, for their guidance and messaging, as well as how to distribute communications, that strategic communications. So as of right now, they're very open to how to do that. They're going to take the advice of Christina Long, as well as Claudia Amaro, and those from the Asian community on how to get that information out. They don't have a plan as far as you saw from the Council of Elders, just how they had their plan, very well written out, as far as cost and how they were going to do that. And so they want to work with Christina and Claudia on just how exactly they're going to put out that strategic communication. So as of right now, they're saying it could be, all types, all different platforms on how to get that communication out. Let me see here. They're saying that their content will include messages of hope, mental health, and substance abuse resource education, including types, locations, and contact information, stigma elimination, warning signs, simple activities to maintain or improve mental health, and advice on self-care. And again, that information will be communicated in multiple languages. And then as far as distribution, the coalition will partner with Project Wichita, nonprofits, public agencies, safety net health clinics, medical providers, including the VA, youth-based organizations, schools, homeowner associations, and faith-based organizations, to name a few. And they're saying that the coalition, that's the Mental Health and Substance Abuse Coalition, already has a vast array of existing partners that understand the need and are willing to help distribute the information that is developed. And avenues of communication include social media, printed materials, various newsletters, apps like Nextdoor, television, radio, and any others that are discovered or recommended. And of course, they were very open, to working with county communications if there was anything we could do to collaborate and coordinate with them. It was a very good conversation. And, as I say, we work with A.B.C. Bilingual Resources, for the Hispanic community, as well as Christina Long with CML Collective. So I'd be happy to answer any questions on that conversation, as well as that one pager that they just sent out. And Akeem, if you have anything else you'd like to add that I missed on that.
No, I think you covered it, Tanya.
Tanya, is it realistic that this can get done within the next month?
Well, and you say next month, does that mean it would have to be done within November's timeframe?
Well, pretty close. You've got to have it all developed, and maybe you can. Are they going to broadcast it, or?
It sounded to me like they were looking at several ways. Printed materials, social media, newsletters. I can tell you that, with county communications, we've jumped on something pretty fast and been able to turn it around pretty fast. I think it would be And I've not had the conversation, but it would have to be the conversation that they would have with CML Collective and AB&C Bilingual Resources, to find out if they can move, fairly quickly on this project. But I think, once you have what the message is, I think you can move fairly quickly on it. It's a matter of being able to get with, depending on what they do, it's, if they need to get on TV and radio spots and billboards, it's whether or not they have the available space. I think social media, I think print ads, I think that you can get that out fairly quickly.
So how do we incorporate the recommendations of Whit O'Brien, which, as Jane has already identified, they basically recommended that these are not fundable, and they do need more information, not enough information to approve this as a viable plan. That's on the distribution of information. How do we, and I guess this is to the committee, how do we incorporate their recommendation with the conversation that Tanya and Akeem, the more detailed conversation that Tanya and Akeem has had with the leads on this?
Just a reminder to everybody that I am recusing myself from the Crime Commission applications.
Thank you.
So Tanya, have you seen that feedback from Whit O'Brien?
I did. I guess the only thing that I understood was the connection of understanding how COVID is related to what they were asking. But I guess to me, seeing how Brenda put that together, I can make that connection of, the stress and the well-being of, if you're laid off, if you have a sick family member, how that could, cause you to need, maybe some mental health services dealing with COVID would be how I might answer that, based on how Brenda presented that need. That's the only thing that I pulled out of that email from Whit O'Brien. Now, if there's more there, then help me understand what that might be.
Well, I guess so. From what I can tell, at least based on the face of the information that you all have, my recommendation to you would be not to fund these. Now, that doesn't mean you can't go back and try and get additional information, but I think that's been done. And so it just becomes a matter of whether this team wants to try and find a way to fund it, in which case we'll need to go back with some very specific questions.
Can somebody help me on the list of what we've already funded? There's a $40,000 to Crime Commission for 679, and then 685, 10,000. Now 10,000 was our research that WSU was going to do. What was the 40 for that we've already approved supposedly? I don't remember approving that, to tell you the truth, but what 40 did we approve?
I'm pulling up the application right now. Let's see.
Because there were 3 applications, I think.
I think there were 4.
Oh, this
I was
is.
going to say,
Oh, sorry. Go ahead.
Okay.
Mm-hmm.
I've just forgotten.
So
you've had a few that you've looked at, Jane.
I know.
This one
Well,
is.
there's going to be 40, and I'm trying to keep the numbers straight.
Yeah,
But
this
we've
one's
approved 2 already.
Yeah, this one's talking about the Wichita Metro Crime Commission's working with the Mental Health and Substance Abuse Coalition.
mm,
And so they're kind of talking about here.
And Hope, tell me what number you're on, 679 or 684?
679.
Thank you.
79 is the one I'm not sure about.
Yes,
Yeah.
that's the one that we have approved. And
and to that point, it looks like for the one that we provided, that we already have approved, it's the telehealth devices, isn't it?
Devices will be given to individuals who have been deemed high utilizers of service in the community who have barriers to treatment that cannot or that can be solved with this solution.
Right, and Widow O'Brien's coming back and saying, we didn't have enough information to approve that, but we had already approved it. So what do we do now?
I think what we need, I think this is probably a viable plan. From what I've seen, what we need to do is go back and work with them to get some additional documentation. But from what I can see, there's nothing about the approach itself that is wrong, because I know actually we have done something similar on the county side, and so we just need to help them bolster their documentation. And we can do that when they submit their materials for actual payment.
Okay.
So that part is not something that I struggle with. I am struggling with the API system.
Yeah.
And I think the research one are ones where I don't know that based on the information that's been provided, if those can be overcome.
We've already proved
API.
We've
I'm sorry?
proved research. We've already proved the research.
Well, and I think it can be, as long as the research is completed by 12:30, and that's the part that's going to have to be somehow done. But again, you all have approved these things. That doesn't necessarily mean that if they can't get the documentation in time for the deadline, that we will actually reimburse.
Okay.
They have to be able to do it, and the agreements specify what those timelines are.
Yeah. And the question about the API, and I think it was raised earlier, the API system, that was questionable from the beginning. We were all suspect, for lack of a different term, as to whether or not there was the connection, and it's not a requirement for responding to or preventing or mitigating COVID. And I'm just reading from what Widow O'Brien has stated. So I think.
Right. So.
Go ahead.
I apologize, Melody.
Oh, no.
I was just going to say there are three main requirements, right? It has to be necessary due to COVID-19. It has to be between March 1st and 12/30th. And it has to basically be something that was not in the budget. So we can't have anticipated it. I think this committee had questions about whether it had already been contemplated before this, whether it was necessary due to COVID. And I think that that's where maybe the documentation hasn't quite been able to meet that threshold that is necessary due to COVID-19.
Okay.
Or at least that's what Widow O'Brien's has said, based on the information that they have available to them.
So I would agree with you, Lindsay, and I would not be in support of recommending it's. I have to look at it. API. What's the number for that one?
That number is 678.
657. 00657. That's what I have. That's for 60,000.
That's actually an old application number, I think, because that one was rejected.
Oh, okay.
Yeah.
I have the old.
Yeah.
I have
Sorry, I
these
was
ones,
also getting a little confused too. The one that you are talking about, it ends in 678.
Okay, 678.
And that's the $60,000, and that's for the API.
Okay.
Just trying to make sure we're all awake here, aren't you?
Oh, yeah. Yeah, I know.
Sorry, did we have a motion on that one, or were we discussing it?
Yes, I'll make it as a motion.
We have a motion. Do we have a second?
Can you repeat the motion?
It's to take the recommendation of Widow O'Brien and not fund 678,
Yes.
ending in the Wichita Metro Crime Commission's proposal ending in 678.
I'll second that.
We have a motion and a second to deny the application number 678 for the Wichita Metro Crime Commission. Can I hear the ayes?
Aye.
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 Any nays? Hearing no nays, the motion passes.
Well, so I think we need at least 4 ayes because the group is 7. I heard, I think, 3. Did Dr. Walker, did you?
Dr.
She's
Walker's
recused.
recused.
I'm recused.
Oh, you're recused.
But
Okay.
I'll-
Do we have Kyle?
And you and Hope can vote too.
Well, unfortunately, I cannot as a staff member. I'm actually not a voting member of the board. For the county, that's just Brent and Hope.
That has to be Kyle. He's the only other one here.
So he may have had to step away. So, Aaron, just as a point of order to be safe, can we maybe come back and do this vote?
We might be.
Oh,
vote
there's
aye.
Kyle. There he
Yeah,
is. Okay, we're safe. 4 to.
I've been
Thank you,
talking
Kyle.
for like 2 minutes to myself.
Oh.
I'm like, I'm sorry.
We've all been there.
Sorry.
Big time.
Yeah, I was like, Kyle, Hope, Jane, and Melody. That's 4. Can no one hear me? No.
No.
Oh, you can't.
Okay, we're in business. Thank you all for your patience.
Okay.
So now the motion passes.
So on this distribution of information one, how much is that amount? Are we still debating whether we want to do that one or not? I guess I didn't understand the dollar amount on that one.
It's 40, I believe.
40,000, yeah. Yeah, I was gonna go back to that one, and we needed to make a decision on that one. For the one ending in 684, it's for $40,000. And we were initially talking about that in the beginning, so.
So it sounds to me like we need them to go back quickly and get some of these questions answered from Whit O'Brien. And I don't know if that's what kind of Lindsay was saying, and then bring it back to us to see if it's going to meet those questions specifically they asked before we would recommend it. And I know we're running out of time on it, but
We can certainly do that if that's the will of this team. We can go and ask the follow-up questions to see if it'll meet the eligibility requirements once we have additional documentation, and we can try and get an answer for you before you meet again next Monday.
Right.
Okay.
Yeah, with that specificity that it meets, that's a tongue twister, that it does meet those requirements. So that's just a request, no motion, right?
Correct.
Right, that does not require a motion.
Can I jump in? Is that something you need me to do, Lindsay, or will your team take care of that?
Will Hope, would you mind sending those, please, since you've kind of had that
Sure, yeah.
ongoing dialogue already?
Yeah, just the follow-up kind of, I mean, that's really good right there. Those are good questions. I know specifically what to ask them. So yes, I can do that.
Isn't that nice
Yes.
to have it scripted for us?
I can do that.
Okay, and I apologize. I think, Lindsay, when you asked me about that WIP question, I think I answered that incorrectly. I think I looked at the top question, and so I apologize for that.
No, you're good. I knew where you were going, and I think we're all trying to get to the same conclusion.
Okay.
All right, well, we can hold off on that one then. With that, that is all of the applications that we needed to follow up on today.
So unless there's any other discussion points or points of business, we can adjourn.
So moved.
And I will get all of that information to you all today.
Great.
Thank
so we're
you.
meeting next Monday, same time?
Correct.
Okay.
Aaron,
And
have we had any new applications come in to the portal?
We have not
Okay.
had any new applications come into the portal since it reopened.
Aaron, can you send us a link to the portal,
Absolutely.
to the announcement?
Yep, I can do that. I'll get that out to you today.
Thank you. Do you need a motion to adjourn?
We haven't done them before, but if you want to make a motion, we can.
Yeah, we've been doing it most every meeting, I think.
Is that a motion, Dr. Walker?
I move that we adjourn.
Second?
We have a motion and a second to adjourn the meeting. Can I hear the ayes?
Aye.
Hi.
Nice, Kyle. Any nays?
You're welcome.
Everybody have a good week.
Yes.
Thank you
We
all
are
so much.
Thank you.
Bye.
Bye.